Your residents are the most important part of your facility, but what happens if harm comes their way? What if they fall, experience bleeding, have to go to the hospital? This could upset family members, cause a visit from licensing, lost revenue, and even lawsuits. Would it surprise you to know that medications can cause these problems? Now what if I told you there is a resource to help reduce harm to your residents, optimize their medication therapy, be an information and educational resource, help save money, and be a selling feature to your facility? And if that wasn't enough, what if I told you you already have this? Well, you do, and that person is your consultant pharmacist. In this short video, I will tell you just some of the ways your consultant pharmacist provides value to your facility. As we get older, our chance of experiencing medical problems increases. When we have multiple medical problems, we are likely to take many medications, and with many medications comes the risk of problems such as medication side effects, drug-drug interactions, drug-disease interactions, dose appropriateness, drug age appropriateness, drug duplications, drug duration, drug administration, and so on. Your consultant pharmacist watches for all these things. Now, if you were to ask me, I would tell you that falls and fractures, bleeding, and unplanned weight loss are just some of the problems that happen in the elderly. Medications commonly used for anxiety, blood pressure, pain, allergies, and behaviors can, by themselves or in combination, increase the risk of falls and fractures, not to mention confusion and excessive sedation. Taking a simple blood thinner to prevent a stroke isn't so simple when a commonly used and readily available aspirin or ibuprofen are also taken for a headache. This combination can cause bleeding that may show itself as a nosebleed, bruising, or black stools, just to name a few. If that wasn't enough, medications can interfere with diseases too. For example, if someone is confused or has dementia and they are given a medication for anxiety, this anxiety medication can make their confusion worse. It can also cause or worsen existing depression. As we get older, our body doesn't process medications the way it used to when we were younger. When our liver and kidneys aren't able to break down and remove drugs like they used to, drugs can accumulate in the body, amplifying the risks and side effects. Doses might need to be decreased or drugs might have to be discontinued. In 1991, Dr. Mark Beers and a group of experts created a list of drugs that are potentially inappropriate for the elderly. This is where potential risks are greater than potential benefits for people 65 years or older. The list is periodically updated by the American Geriatric Society's panel of experts. Interestingly, many drugs on this list are commonly prescribed for allergies, anxiety, depression, psychosis, insomnia, pain, weight loss, and so on. Your consultant pharmacist watches for these medications and makes recommendations where appropriate. Many medical conditions often means more than one physician, which can lead to duplication of medication. With duplication of medication, safety risks are increased and so are medication costs. Aside from duplication of therapy, it is common to find a resident left on a medication for too long. Let me give you an example. Mrs. Smith complains of heartburn and is prescribed a common medication to treat heartburn. Instead of limiting it to a few short weeks, she is left on it, and now her risk for wrist and hip fractures increases, as well as getting certain types of infections. Again, your consultant pharmacist watches for this. Sometimes just taking the right medication incorrectly can cause problems. Some medications need to be given with food to be absorbed into the body, and others need to be given on an empty stomach to make this happen. If someone uses a steroid inhaler, they should rinse their mouth out afterward, otherwise risk getting a type of mouth fungus. Diabetic drugs given incorrectly can cause hyper or hypoglycemia. The list goes on, and the bottom line is, when drugs are not given correctly, three things are likely to happen. The benefit isn't realized, harm happens, and money is wasted. Your consultant pharmacist can also help educate your staff by providing written, electronic, or live in services, as well as drug information. And informed staff leads to greater medication safety for residents. The very last thing I will mention is that you can use your consultant pharmacist as a selling feature for your community. Just knowing some of the benefits I mentioned, you can confidently let prospective residents and their family members know that a pharmacist is part of your team, looking out for their best interest. I hope this short video got you interested in your consultant pharmacist, knowing that he or she can help reduce harm to your residents, optimize their medication therapy, be an information and educational resource, help save money, and be a selling feature for your facility.